the floor is now open for questions.
Hey, everyone. Thank you so much for that, Dr. Francisco, and also Dr. Ramirez and Dr. Perez-Lirio. So we're going to be taking some questions, and the doctors will be answering them. This question is from Emmy in New York and Suzette in New Jersey regarding antibody tests. Will it be available to all, even those who are asymptomatic? I heard it can cost us hundreds of dollars, and why? Dr. Francisco, you touched on the antibody tests a little bit during your presentation. Can you answer this question for us?
Sure, thank you for that question. So antibody testing is becoming more widely available. At least in Massachusetts, there are several labs here that are starting to offer antibody tests to almost anyone who wants one at a cost. And this may not be covered by insurance yet, just because this is so new. The cost of the test can range from $35 to a few $100s. So for example, at Boston Heart Diagnostics in Framingham, Massachusetts, you can get a test for an antibody test for $35 with a doctor's order. Quest Labs offers this test for $119 without a doctor's order. So you can just go to their website, pick the test, and then pay for it, and then you can get it done. There are also several urgent care facilities in Massachusetts, and I think also in New Jersey, that offer this antibody test. So, however, since this test is so new, just bear in mind that there are concerns about the accuracy and limitations of these tests, as discussed earlier in my talk. Thank you.
Dr. Francisco, thank you very much for that. We do have another question from Suzette in New Jersey. If one has been infected with COVID-19, does this mean you're immune for life? Or is it like the common flu where you get vaccinated every year? And I think, Dr. Francisco, if you could talk about this one again, because also that's the big question with the antibody tests. A lot of people want to know, okay, if I have the antibodies, does this mean I had it? And then if I had it, does this mean I won't get it? And, can I go back and work in the healthcare field? A lot of people have these questions. Dr. Francisco?
Thank you. So what we currently know now is that when an individual gets infected with COVID-19, that they develop some form of immunity. However, how much antibody is protected and how long the immunity lasts are still under investigation. There have been reports of individuals who have recovered from COVID-19 and then tested positive again. So does this mean that people can get reinfected with COVID-19 or with the virus? Some experts question this reinfection rate, whether this is true reinfection or persistence of the infection versus limitation of the PCR test, and that the PCR test cannot distinguish between genetic material from an infectious virus or dead virus fragments that can linger in the body for after the patient recovers. So at this time, there is a lot to be known about this virus. And so there are currently a number of studies on antibodies, immunity, and vaccines that are underway from all over the world. And we're hoping to get more answers pretty soon.
And that is, really what this all comes down to. There's still so much unknown about this right now. And we've been saying the same thing in the news too, that, we ask so many questions, we ask doctors, we ask healthcare professionals, but at this point, it's something that's unknown to all of us. And our next question is something I've heard a lot, especially early on. Dr. Ramirez, if you could address this for us. A lot of restaurants, they're open for pickup, they're doing delivery. People want to know, is it safe for us to eat the food? And we're not just talking about eating the food, but we're getting the packaging if we're walking into the restaurant to pick up the food. How safe is this for us?
So that question is raised by a lot of my patients, and I usually tell them it's safe to have takeout. But remember Dr. Francisco's slide that you can have transmission via the packaging. So make sure you handle those packaging just like you have to wipe them and make things clean, and also safe handling of food. The main transmission of COVID anyhow is droplet infection and not foodborne. It's not a foodborne pathogen.
Okay, so I'm not going overboard when I take the wipes and wipe down my pizza box before.
I think you're doing the right thing.
Okay, good. That's a good thing to know. Let's go to our next slide for our next question. This is from Ellen here in Massachusetts. will ordering or buying products shipped from overseas make a person sick? So that's along the same lines. People are wondering, okay, I'm ordering these Amazon products. Some of them may still be coming from China. People have been concerned because that's where the virus originated. What do we say about the packages that we receive, and not just the packages themselves, but the contents of them? Dr. Ramirez?
Same thing, same advice that I would say. You just have to like sanitize everything, make sure everything is clean and wipe down with sanitary wipes, and that will prevent if there's a virus in there. But as the slide from Dr. Buencamino-Francisco, that it can live there for like 24 hours to 3 days.
Okay, so again, I'm not wrong when I wipe everything down before I bring it in the house. Okay, thank you, doctor. Our next question is also from Emmy in New York. And this one is, will COVID cause respiratory damage or challenge in the future for those who've survived it? We've heard so much when we talk about people who are in the hospital and the challenges. Really, this is a big respiratory problem. Dr. Perez-Lirio, can you address this one for me?
Thank you, Antoinette. So for SARS-CoV-2 can cause mild symptoms, like you heard earlier, to severe respiratory illness like pneumonia and acute respiratory distress syndrome, or ARDS. So these conditions occur as a result of inflammation in the lungs. And for the most part, people recover from this, although ARDS has a high mortality rate when you develop that. We don't know yet whether one would have long-term sequelae as a result of COVID infection involving the lungs. There's Johns Hopkins, there's a statement that was released by a doctor over there, and he said that like any other respiratory illness, this may cause lasting lung damage. So we're going to need longitudinal studies to see that. But as of right now, I think, as a primary care physician, my take here will be, if you smoke or you use vaping products, I would recommend that you don't, and just have a healthy existence, exercise, good diet, and all those things.
Great. Good advice, doctor. Thank you so much. Now let's go to our next slide. This is a question from Raquel in New Jersey. For someone who got tested for COVID-19 but is asymptomatic, what should that person not do to make himself or herself sick? Dr. Ramirez, can you talk about this one?
Oh, so if you get tested positive, the main thing is isolate yourself, and I give the same advice as having a flu. Drink lots of fluids, rest. Maybe this question is stemming from like earlier reports in which there's like supplements that helps with the COVID infection. I think those supplements and medications didn't really give good evidence in preventing COVID or preventing yourself sick or symptomatic with COVID.
If someone's asymptomatic, when they test for COVID, do they necessarily stay asymptomatic, or is it possible for them to develop symptoms?
So development of symptoms is from day 2 to day 14. So if you get tested at day 2, if you're asymptomatic and you tested positive, you might not be developing the symptoms yet. So that means you need to self-isolate. That's why self-isolation is very important, because that means you cannot transmit it to your members of your family.
That is key. That is what everyone's been saying, is isolation is key here. Now we want to go to a question from Gary here in Massachusetts. Do people with asymptomatic infection have lower viral loads? Let's go ahead and go to you, Dr. Francisco, if you can talk to this one.
Yes. So first of all, let's define viral load. So viral load is defined as the number of viral particles. And people with asymptomatic COVID-19 infection have similar viral loads compared to those who have symptoms, based on a study published recently at the New England Journal of Medicine on asymptomatic transmission in a nursing home in Washington State. There was also a study published from China with similar results. However, that study from China showed that the viral loads from patients with severe disease were higher than those with mild to moderate disease.
I'm muted. Now I'm not muted. There we go. Going back to the talk of asymptomatic patients. So let's direct this question at Dr. Perez-Lirio. Is there a way to cure asymptomatic patients? Do asymptomatic patients also need to quarantine? How long? And then how will you know after that self-quarantine phase that you're cleared? Because of course you're asymptomatic. So it's hard to know when you're okay. So what should one do? Dr.
Very
Leary?
tough question here. Thank you. You may be referring to a case of a positive test in an asymptomatic person. Basically, because you don't have symptoms, you don't need a treatment. Even people who have full-blown COVID-19, really, we don't have a known treatment for that. So basically, just healthy existence, like I mentioned earlier. So should you self-quarantine? No, not quarantine, because that's. I don't think that that's recommended. Again, there's no known cure for COVID-19, whether you have symptoms or not. And as far as how will you know after the self-quarantine phase that you are cleared from the virus without testing? It's hard to know because we're not really retesting people if they are asymptomatic at this time. I wish I had a better answer for you, but this is a tough question.
Yeah, it really is. And we've been dealing with the same thing in the new country as well. People are wondering, well, this is the big talk about the wearing of the masks. It's because there are potentially so many people that are asymptomatic, and without any symptoms, you don't know if you're okay. So that brings us to our next question. If you're asymptomatic, then how contagious are you? And then what can you do to prevent infecting others? So I'm guessing, Dr. Francisco, part of this is self-quarantining.
Yeah, so first of all, so I think the question is on asymptomatic COVID-19 individuals. So another tough question. What we do know is that people with COVID-19 infection are most contagious when they are symptomatic, right? However, some scientists believe that the highest rate of transmission is in the pre-symptomatic phase, based on a study done in China, which showed that about 44% of COVID-19 cases may spread from person to person even before the symptoms appear, right? So more studies are definitely needed in this regard to determine how contagious really are these asymptomatic individuals. And regarding prevention, so if you are asymptomatic and happen to get tested for COVID-19 and the test came back positive, then you still need to follow the general precautions as if you are symptomatic. So I just saw a recent guideline from the CDC for asymptomatic COVID-19 individuals. The recommendation is to self-isolate for 7 days. So also, we all need to adhere to preventive guidelines such as physical distancing, good hygiene, hand washing, wearing your mask, and all these to prevent transmission of the infection to healthy individuals.
Okay, and then that leads us to our next question, which is from Ricky in Manila. Given that some people may get COVID-19 and they're asymptomatic and then they recover without even knowing at any point that they had the virus, what do these individuals have in common that may be of interest to combat the virus? So we've talked about antibody tests, we've talked about plasma. Dr. Perez-Lirio, can you address this one?
Because this is a new virus and disease, we do not have specific data about host factors that determine whether SARS-CoV-2 exposure will cause symptoms or not. So if your question is about whether exercise, diet, supplements have to do with how one will respond to exposure to SARS-CoV-2, data on that is forthcoming. But so it will really take a longitudinal study to understand this. Again, I wish I had a better answer for you.
Yeah, there's still so much unknown right now. Dr. Ramirez, this next question is for you. From Emmy in New York, who has a friend who's 7 months pregnant. What would you advise her? What is the effect of COVID-19 on pregnancy, and could it affect her baby?
So we have like pregnant patients in our health center. And what we tell them is that the pregnancy, if you have a healthy pregnancy, you don't have an increased risk. This is the same risk as general population, so which is good news. Second, there's no evidence that there's vertical transmission of the virus. So that means if you're pregnant, you cannot give it and you tested positive, there's no evidence that you're going to transmit it to your baby. The other good news is that it's not transmitted by breastfeeding. So you can breastfeed. Hopefully, we all hope that all these pregnant patients are all healthy. The only problem when you breastfeed is, of course, droplet transmission, which is the main transmission of this virus.
Okay, great.